Welcome. My name is Dawn Macary with the Western Connecticut Area Agency on Aging, and we have a new show entitled Working Together with the Western Connecticut Area Agency on Aging. The agency serves 41 towns in Western Connecticut. We offer free, unbiased information to individuals on Medicare and persons with disabilities on Medicare regarding Medicare insurance, Medicare Part D, Medicaid, new to Medicare, respite care, the home care program, money follows the person, assistance filling out applications, senior Medicare patrol, which is Medicare fraud, and a variety of other programs to help keep individuals independent and at home. And today I am very happy to say our guest is Marion Pollack, and Marion is a care management coordinator and an RN. Welcome, Marion.
Well, thank you so much, Dawn. It's a pleasure.
And we're going to talk a little bit about what Marion does. But first, she's going to be talking about dental, eyeglasses, and a little bit about holistic care.
Before I get into those subjects, Dawn, I just want to tell you a little bit about myself.
That would be great.
And where I'm coming from. I've worked at Western Connecticut Area Agency on Aging for 19 years, so I'm really a solid citizen there. And I have been involved in many programs. At this time, I'm very active with the senior housing and low-income housing in various areas that our agency serves.
All right.
I have 8 resident service coordinators.
Wow.
That I supervise. I recruit them, I train them, and supervise them as advocates for the elderly and the disabled in their housing units.
Yeah, what is a resident service coordinator? Someone in our audience might not know what is that, or they hear that word RSC, resident service coordinator.
Right.
What is that?
It's a pretty nice term, I'll tell you, and they feel wonderful about serving in that capacity. A resident services coordinator is someone that advocates for the person that they are helping.
Okay.
They might need help in having, as they are hospitalized or ill, and they need help to be brought in to help care for them at home, to keep them independent for a short term or even for a longer term, because the state, it is sponsored by the state and also the housing and federally funded, and therefore their mission is to keep individuals in their own apartments for as long as possible without having them go into nursing homes.
So they might work like a 35-hour week at a certain housing complex?
Correct.
Okay, and then they're there 5 days a week to
Not
answer
all
questions?
of them. Some of them are part-time, and they might be there 2 or 3 days a week.
Okay, but they help with fill out paperwork if the resident has any kinds of questions. So do most housing complexes have resident service coordinators?
Not all do.
Not all do.
Not all do. It has to be something that is requested by the housing authority.
Oh, okay.
For funding.
Well, it sounds like they're a very important
they are
part of the aging process when you have to move.
Absolutely.
So. But let's get on to what else you do.
Well, I also do some auditing for my agency, go to other agencies and housing facilities and make sure that their files are done properly, their documentation is done, and also that the residents that they serve are up to par in getting all the information that is actually needed.
Okay, wow, that keeps you pretty busy.
It does indeed, and I do a lot of things that answer questions. I do travel to various meetings, of course, and set up meetings for my resident service coordinators on a monthly basis.
Very good. That's what keeps you so young, Marion. I'll tell you.
Well, you know, my age, I've told everybody that I should be retired many times over, but I love what I do. I have a passion for helping people. And even though I'm going to be 85, and don't tell anybody, I still feel that I have a purpose. And as long as I have my gray matter and my mobility, and I'm able to do the job, I'm going to stay and encourage my resident coordinators to carry on.
Yeah, and I've worked with Marion for many years, and I can honestly say she has more energy than me. Where she gets it, I have no idea. But this woman, she is one of the few people in the world that just gives and gives and gives no matter what. She is always there. But
thank you very much, Dawn. And you know, when you give, you get.
That's true. That's true. So anyhow, although a lot of our viewers are probably interested in dental and vision for seniors, because Medicare doesn't cover it. They don't want you, nothing for the eyes, nothing for hearing, nothing for chewing.
The vision is, I think that Medicare will cover if you had cataract surgery.
Cataract surgery,
They
correct.
will pay for your glasses, because after cataract surgery, you know, you do need a lens change.
Right.
And they will cover that for you. We do have resources at the agency for those people who absolutely do not have any funding to cover glasses. We can refer them to special groups where they can receive some funding. Okay. Now, as far as the vision in itself, I cannot stress enough how important it is to take care of your vision. We only have our vision for as long as we can keep care of it. And of course, we hear about glaucoma, and we hear about all kinds of terrible diseases.
Macular degeneration.
Macular degeneration. And therefore, it is very important to go for your yearly
eye exam.
Eye exam, yes.
Okay, so so if they want more resources for eyes, they can give the agency a call and ask for you?
Yes, certainly. Okay, I'd be happy to take the call.
Okay, the number is running at the bottom of the screen, and you can just ask for Marion, and she'll be happy to help you.
Absolutely.
Since she has slowed down a little bit. She only works at the agency 3 days a week now.
Instead of 5.
Instead of 5. So,
but that's okay. I'm there Monday, Wednesday, and Friday. And I usually have a message machine so that if I'm not right at my desk, you can leave your name and number, and I will certainly make it my business to call you back.
Okay. And what about dental, Marion?
Dental's
a big problem.
Of course, dental is near and dear to my heart, because I think most people do not have dental coverage.
Right, absolutely.
I can tell the audience that I volunteer every year. This was my 9th year of volunteering for Mission of Mercy, which is a group of volunteer dentists that come for a weekend in different parts of Connecticut, and they will give you free dental care, including root canals, fillings, extractions, x-rays, no charge, and no questions as to need. You just go. If you know you have pain or you need something that you've neglected, please. It's advertised fully on TV, and it's a wonderful service, and it's all free. You know that wonderful 4-letter word, free.
Free, absolutely, yeah.
And of course, dental care, if you want to do anything at all for your oral hygiene, make sure that you get your teeth cleaned every 3 to 4 months.
Right.
That is very, very vital.
Absolutely.
Because infection leads to other serious problems. And we have a list of clinics.
Okay.
If you cannot afford a dentist or a hygienist, we have a list of clinics in your area that will also be very happy to give you names and numbers to call for assistance with your dental bills. Okay. So that's number 2.
So that's that's very good. Again, look at the phone number at the bottom of the screen, call and ask for Marion, and she can give you the names over the phone, or she can send you the list.
Absolutely, I'd be happy to.
Like I say, a lot of these services, people don't realize that they're out there, and I think, Marion, a lot of services that our agency offers, people don't realize it.
They're not aware of it.
They are not aware of it at all, and we serve people disabled on Medicare and individuals on Medicare.
Absolutely.
So
in our 41 towns.
In our 41 towns of Western Connecticut. So we do have an awful lot of programs there. So now you're going to talk about something a little bit different, alternative medicine.
A little different, and it was a very controversial topic that you assigned me. I think the idea of alternative medicine is fairly new in the western part of the world.
Yep.
In other countries, their cultures and their faiths, they would concoct different types of procedures and herbs and animal parts and all this other stuff because they truly believed it would help to heal. It's a little different in that we have fought for many, many years the fact that some of this type of medicine, so to speak, I don't even know if they'll call it medicine, but healing procedures and supplements, the medical profession has always questioned the validity of this type of.
Okay, so are you like talking about like acupuncture would be one of them?
That would be one of them, but they've come to accept acupuncture now.
They have.
Oh yes, in fact, many of the insurance policies will accept
acupuncture? Okay, I didn't realize
and
that.
if you make a claim. And I think that's very important. Chiropractors were never really accepted by the medical profession for a long, long time.
Right.
But now they feel there is a benefit in the manipulation of the spine for comfort or for different.
And I believe that's covered under Medicare.
Yes, that's what I'm
Manipulation of the
saying.
spine. Yeah, that is covered
it
under
all
Medicare.
depends on the policy.
Right.
But most of my cronies, so to speak, are into the supplements like omega-3, fish oil, and some of the vitamins which they feel will help the heart or perhaps not necessarily endorsed by the medical profession. But there's so much information out there about the possibility that they cannot harm you, but they could only enhance what you're neglecting or what you're limited. For instance, calcium.
Okay, right. We all need that.
Calcium, many people do not drink dairy products. They are allergic to dairy, or they do not drink milk or milk products, and they do need the calcium. So they really should, in my opinion, be taking a supplement.
Even if you're older, Marion?
Oh yes, definitely. It's for your bones,
Okay.
teeth, bones.
So that helps you even, because I thought once you got to a certain age, I don't know, maybe I'm wrong, that you just
You're
weren't going to
kind
get
of
the calcium.
thinking about a pap test, right? When you get to a certain age, you don't need a pap test. That's wrong too.
Oh,
Okay.
boy, oh boy.
But I wanted to just describe some of the acronyms that they discuss in literature about complementary, as they call it, complementary medicine, or integrative, what would you say?
Integrated.
Integrative
Yeah.
medicine. That is something that is used in combination. It's called CM, and it's used in combination with what your primary doctor is ordering, and they might order or endorse some of your supplements to enhance what your losses are.
Okay, like you mentioned, fish oil. Now, fish oil is good for
Omega-3.
the heart. Is that
Yeah,
right?
yeah.
Okay.
And also, I think it's also supposedly good for your cholesterol. Or
Okay.
yeah, I think so.
So might a doctor recommend that you take
omega-3.
that?
Yeah.
Okay,
yeah,
so
yeah.
that's
They might. Now, a lot of medical schools would never have taught any courses in alternative medicine at all.
I know it's really
And
coming
now,
on its own now. Yeah.
now I did a study on this information, and they have 175 medical schools in the U.S.
Okay.
And I believe 75, I think it was 75 have incorporated alternative medicine
Medicines.
course.
Yeah, which is good because I mean, so many seniors and those on Medicare and disabled take so many medications, and they can interact with each other,
Right,
and they can be
that's
very
true.
expensive, where
Right.
the alternative methods are a lot less. I mean, we have so many stores around in the malls, these GNC stores, I guess they are, that sell a lot of alternative,
And you can go to the dollar store too, and you
and the
can
dollar store.
And
Yep.
I'm wondering about the quality. That's the only thing that I question. I
Okay.
think make sure you read labels, make sure you're getting the dose that is especially scripted for you or told you should get it. And I would go to manufacturers that are recognized.
Like I think there's Nature's Made
Yeah,
is
Nature
a,
Made,
is
yes,
is a big
yes.
one. So go to the larger ones out there.
Right.
Because I know there's another drug out there. It's not a prescription drug, melatonin
Melatonin is supposed to be for sleep,
for sleep. Okay.
but that would be something that I would check with my doctor about.
You would.
I wouldn't take it on my own.
Okay. What about something like for anxiety? A lot of people I know as they age they get very anxious about things.
Well, there's also Reiki,
Okay.
which is a procedure.
Oh, what is that?
Reiki, I believe, is something that is done by a master person who does Reiki, and they have healing powers and energy in their hands, and they could find out where you're anxious or you have pain, and they know exactly how to deal with that. And some people have wonderful results with Reiki, and some do not. Massage therapy is a wonderful therapy for not only circulation, but also for relaxing you, de-stressing you.
So it's good for men too.
Oh,
Massages are
absolutely.
not just for women; they are for men also.
Absolutely, and they love it too.
And I'm sure that they do. But
Yes, yes.
But there's a lot out there. Are there a lot of doctors that are getting into this, like in Connecticut?
I think so. And unfortunately, the older generation has never been accepting of the supplements and the products, but the younger people and the new age, so to speak, have really come forward and said it enhances what you're lacking in your body. And as your body ages, you lose a lot of things.
Right, so you're getting the direct vitamin right from the
you
supplement.
lose a lot of elasticity. That's why you know.
Yeah.
I don't have
Botox. No, I don't have any.
Well,
of it
now
yet.
that would be considered an alternate procedure.
Really?
Oh,
Yeah.
sure.
Oh, I didn't realize
Yeah,
that.
yeah,
I'll have
yeah.
to keep that in mind.
Sure.
Oh.
But people are coming around if you feel good about it, if you have a good attitude, and I think if you have a positive attitude,
Oh, absolutely.
it can't but help you.
Yeah, I think attitude is a lot. You have to
I
have
think
have
so.
to have a good attitude
agree
about
with you.
things. And I know they have glucosamine out there, and that is for
And that's for the
arthritis.
joints, yeah,
That's been out there
yeah,
for
yeah.
arthritis a long time. And I know my husband takes it himself, and it does help his arthritis. Mm-hmm. It's unfortunate there's no cure for
Of
arthritis.
course, they
but it
say
does help.
exercise will help too.
Exercise helps everything.
I know, and a lot of people are not into it, but it is very helpful to keep your joints, moving.
Yeah,
Keep
it is hard.
moving.
Even if you can go out and walk, if you live in a senior housing, walk around the building outside, walk in the halls if you're not sure, because
People
they
go
have
to the
bars.
mall.
They go to the mall. We have the
'Cause
mall
it's a
walkers.
nice
flat surface. Even if you can get out there for 20 minutes, it's good exercise. And it keeps you
Absolutely.
going.
Absolutely.
Because you can really become, when you're sitting home and you're retired and you're watching TV or whatever, you can really become a couch chair potato.
That's true.
Yeah.
That is very true.
Yeah.
Anything else you'd like to discuss with this?
Should people have any FDA concerns about any of this?
Well, the thing is, I don't believe that the American Medical Association did any clinical trials on supplements.
Okay.
And they actually said that they did not believe in their effectiveness.
Okay.
And therefore they weren't going to, approve it.
Okay.
However, a lot of individuals and and physicians and veterinarians believe that it is helpful.
Also, a lot of veterinarians. So
Yes,
like if you,
yes, they do it to animals.
Oh, really?
Oh, sure.
Oh, that's
Yeah.
amazing.
I think the article that you had submitted to me was opinion of a veterinarian.
With different alternative medicines.
Yes, yes.
Yeah. So I mean, I think I had a sister. She's since passed away, but she used to take like 10 alternative medicines a day to help her. She did not take any prescription drugs.
Really?
Yeah, and but she had a very severe illness, but she passed away. But she just lived on all these different vitamins and things like that.
If she believed in them, I think it helped her.
Absolutely.
Because
now, what do you think, Marion, about nutrition? Because a lot of people, as they age, they just don't eat right. Myself personally, I would rather have a nice piece of cake with a cup of coffee than a hamburger.
Oh,
I'm one of those. I love
protein. You need coffee does not have protein.
No protein in
unless
coffee.
you use cream.
I do use cream. I do
it
use
has
cream.
a little milk
Yeah.
and protein, but nutrition does play a very, very big part in your general health. As everyone knows, you are what you eat.
Okay.
And many individuals have allergies to certain foods. They can't have dairy products, so they have to rely on some supplements to get it into their system so their bones will stay nice and firm.
Which is good.
And not break when they fall.
So they should have 3 meals a day.
They should have at least 2 good meals and maybe a light one.
Yeah, because I know sometimes it's so hard to, you're by yourself to, make a meal.
They don't have the interest.
They don't have the interest. Because I know you cook. I've been over to Marion's house several times because we're good friends also. But I mean, you're always cooking at your house.
I love cooking.
Yeah.
I
so
love
we're all
cooking,
going to go over to your house.
But I love sharing my cooking.
Right,
see?
you do.
And I think it's important. I always try to have a pot of soup, whether it's a vegetable soup in the winter or a chicken soup, whatever. But I put lots of vegetables in, and I think it's important to have a sustenance.
Okay. Yeah, absolutely. I'm wondering too, Marion, on these alternative drugs, like the glucosamine, melatonin, and fish oil. Are there side effects that people need to watch out for these?
Dawn, I have to tell you, whatever you take, there's always a possibility of an allergy. No one knows how your body's going to react. But for the most part, nobody experiences that, but there's always the first time.
So you might want to start off, because I know you go to the store and they have these big jumbo bottles, of fish oil that you have to take, or to take. Maybe they should start off with a small bottle first to make sure that
that's a very good idea. And the other thing is, I know that one of the doctors I was talking with at one time, we discussed the COQ10, which is a supplement, and they say it's very good for your heart and for your circulation. And I put myself on it for...
Oh, did you?
I did. But I happened to notice that it wasn't getting absorbed in my system.
How did you find that out?
I checked the toilet.
Okay.
And then I found out they make it in liquid.
Okay.
For better absorption. So that's something that people might want to check.
And what do they call that again?
COQ10.
And what does that do?
It's supposed to be a supplement for your heart to make it stronger.
Okay.
We don't know. We don't have the facts. We don't have the proof. But a lot of people have been on it for years, and they do swear that it's helpful.
Oh, okay. Well, that's good. That's good to know. So about the doctors, so you said many of them don't endorse the supplements?
Many of them, the older doctors kind of poo-poo the idea. I think because when they went to medical school, they didn't have courses in supplemental medicine or alternative medicine, and they just never agreed that it wasn't tested and approved by FDA, so they didn't endorse it. But I think a lot of the newer physicians have come around to it.
Do you think before someone starts this type of a regimen, Marion, that they should check with their doctor first?
Absolutely. It's good to get their feelings up front.
Yeah, absolutely.
And they'll be very direct with you one way or the other. You could take it, Mrs. Jones, if you want to, but I don't always feel that it's going to help. You know, they might say something like that,
Yeah.
but that's your choice.
That's your choice, but you
Yeah.
should check with the doctor before you take any
Absolutely.
of these any of
Absolutely.
these over the counter. Well, I would like to thank Marion Pollack
Thank
for
you very much for
coming on our show, and
I like this opportunity to spread education to wherever we can.
right. So for dentistry and vision, and if you have any other questions, the phone number is at the bottom of the screen. You can give it a call and ask for Marion Pollack, and she'll be happy to discuss any other things with you.
Absolutely.
And I would like to thank all of you out there for watching our show, Working Together with the Western Connecticut Area Agency on Aging. Together, we can help you with many programs that are available to keep you or your loved one independent at home. Thank you.